Hello, and welcome back to The Vital Years, the podcast dedicated to supporting your health journey through every stage of life. Today, we are focusing on a health challenge that is particularly prevalent among older adults: chronic insomnia. This isn't merely about occasional restless nights. Persistent difficulty sleeping can have significant and serious consequences. Chronic lack of sleep can negatively impact physical health, emotional well-being, cognitive function, and even increase the risk of accidents like falls. It can be a source of considerable frustration and worry, affecting overall quality of life. Addressing this issue is vital for maintaining health and independence in later years. Today, we are joined by a medical expert who has extensive experience helping patients manage sleep disorders. He understands the clinical aspects and the profound impact insomnia can have on an individual's life. Please welcome Dr. Richard Hayes. Dr. Hayes, thank you for being with us to discuss this important topic.
Thank you, Emily. It's important to discuss this topic openly, as insomnia is a challenge many older adults face, and its effects are far-reaching. I appreciate the opportunity to share information and potential solutions.
Dr. Hayes, as people get older, changes in sleep patterns are common. Could you explain the physiological reasons behind this? And importantly, what are the early indicators that a person might be experiencing chronic insomnia, rather than just typical age-related sleep changes?
Certainly, Emily. It is true that sleep architecture changes with age. We tend to spend less time in the deeper stages of sleep and REM sleep, and sleep can become more fragmented, meaning awakenings during the night are more frequent. The timing of our sleep-wake cycle, the circadian rhythm, can also shift, leading some older adults to feel sleepy earlier in the evening and wake up earlier in the morning. These are physiological shifts associated with aging. However, when these changes lead to significant distress or impairment in daytime functioning, it moves beyond normal aging into the realm of chronic insomnia. Insomnia is typically characterized by persistent difficulty initiating sleep, maintaining sleep, or waking up too early and being unable to return to sleep. For it to be considered chronic insomnia, these difficulties usually occur at least 3 nights per week for a period of 3 months or longer, despite having adequate opportunity for sleep. Identifying early signs is key to addressing the issue before it becomes more entrenched. Look for these indicators: consistently taking longer than 20 to 30 minutes to fall asleep when you first go to bed, waking up multiple times during the night and having trouble getting back to sleep, waking up significantly earlier than desired on most mornings and being unable to fall back asleep, feeling unrest or unrefreshed upon waking, even after a full night in bed. This indicates poor sleep quality. Experiencing daytime consequences such as fatigue, low energy, difficulty concentrating, irritability, or impaired memory. Developing excessive worry or negative thoughts specifically about sleep, which can itself contribute to the problem. It is crucial not to dismiss these persistent difficulties simply as an inevitable part of growing older. While some changes are expected, chronic sleep deprivation is not healthy and should be evaluated.
Thank you for clarifying those early signs and the distinction between normal changes and problematic insomnia. You mentioned the negative impact earlier. Could you elaborate on the specific risks and dangers that chronic poor sleep poses for older adults? This is often a significant concern for our listeners.
Yes, addressing the potential dangers is important because it highlights the need for proactive intervention. For older adults who may already be managing various health conditions, chronic insomnia can indeed pose serious risks to their health and safety. One of the most immediate concerns is the significantly increased risk of falls and accidents. Sleep deprivation impairs balance, coordination, alertness, and reaction time. Being unsteady during the day or getting up at night while groggy greatly increases the likelihood of a fall, which in older adults can lead to severe injuries such as hip fractures, potentially resulting in loss of mobility and independence, and requiring prolonged recovery or institutional care. Chronic lack of sleep also has a detrimental effect on cognitive function. It can worsen existing memory problems, impair concentration, reduce alertness, and negatively impact executive functions such as planning and problem solving. While research is ongoing, poor sleep is also being investigated for its potential links to an increased risk or acceleration of cognitive decline and dementia. Furthermore, chronic insomnia is strongly associated with negative impacts on mood and mental health. It increases the risk of developing depression and anxiety and can exacerbate these conditions in individuals already affected. The persistent frustration and exhaustion from lack of sleep can significantly diminish emotional well-being. Insomnia can also complicate the management of existing chronic medical conditions. For example, it can make it more challenging to control blood sugar levels in patients with diabetes, elevate blood pressure in those with hypertension, and increase the risk of cardiovascular events. It also impacts the immune system. Finally, there is the pervasive loss of quality of life and independence. When sleep is consistently poor, energy levels are low, making it difficult to engage in hobbies, social activities, exercise, and daily tasks. This can lead to isolation and a reduced sense of self-efficacy. So, while it begins with difficulty sleeping, chronic insomnia has tangible and serious consequences for the health and safety of older adults. However, it is a treatable condition, and there are effective strategies available.
That is why addressing this is so critically important. It's quite sobering to hear about the risks, but as you said, there are strategies. Let's shift our focus to what can be done. For someone who is just starting to notice some difficulty with sleep, perhaps the early signs you described, what steps can they take now to prevent the problem from becoming chronic? What are the foundational lifestyle changes that can significantly improve sleep?
That's the critical point: empowerment through action. For individuals noticing early signs or simply wanting to optimize their sleep as they age, implementing robust sleep hygiene practices and making key lifestyle adjustments are the initial and most impactful steps. These strategies build a strong foundation for healthy sleep. Sleep hygiene involves establishing consistent habits and creating an optimal environment for rest. Maintain a consistent sleep schedule. This is fundamental. Go to bed and wake up at roughly the same time every day, including weekends. Consistency helps regulate your body's internal clock, the circadian rhythm. This routine strengthens your body's natural signals for sleep and wakefulness. Optimize your sleep environment. Your bedroom should be conducive to sleep, dark, quiet, and cool. Use blackout curtains, earplugs, or a white noise machine if necessary to minimize disturbances. Ensure a comfortable temperature, as being too warm or too cold can disrupt sleep. Designate your bedroom primarily for sleep. Avoid using it as an office, dining area, or main television room, as this can create an association between the bedroom and wakefulness. Be mindful of naps. If you find naps necessary, keep them short, 20 to 30 minutes, and try to take them earlier in the afternoon. Long or late-day naps can reduce sleep drive at night, making it harder to fall asleep. Limit stimulants and alcohol. Avoid caffeine in the afternoon and evening. Remember that caffeine can be found in coffee, tea, soda, and chocolate. While alcohol may initially induce drowsiness, it disrupts sleep architecture later in the night, leading to fragmented sleep and more awakenings. It is advisable to avoid alcohol close to bedtime. Time your meals and fluids. Avoid large meals close to bedtime. If you frequently wake up during the night to use the restroom, try reducing fluid intake in a couple of hours before going to bed. Establish a relaxing pre-sleep routine. Create a buffer period of 30 to 60 minutes before bedtime to wind down. Engage in calming activities such as reading a physical book, listening to quiet music, taking a warm bath, or gentle stretching. Avoid stimulating activities like engaging with electronic screens, working, or discussing stressful topics during this time. This routine signals to your brain that it is time to transition to sleep. Get out of bed if unable to sleep. if you are unable to fall asleep after approximately 20 to 30 minutes. Or if you wake up during the night and cannot get back to sleep within that time frame, get out of bed. Go to another quiet, dimly lit area and do something relaxing until you feel sleepy. Remaining in bed while awake and frustrated can create a negative association with the sleep environment. Return to bed only when you feel genuinely tired. In addition to sleep hygiene, broader lifestyle factors contribute to better sleep. Regular physical activity. Engaging in regular exercise most days of the week can significantly improve sleep quality and duration. Aim for moderate intensity activity. However, it's best to avoid vigorous exercise within 2 or 3 hours of bedtime, as it can be stimulating. Manage light exposure. Exposure to natural daylight, particularly in the morning, helps regulate your circadian rhythm. In the evening, dim indoor lighting and minimize exposure to bright electronic screens, phones, tablets, computers, television, as the blue light emitted can interfere with melatonin production. Stress management techniques. Chronic stress and worry are major contributors to insomnia. Incorporating stress-reducing activities into your day, such as mindfulness, meditation, deep breathing exercises, spending time in nature, or talking with someone you trust, can have a positive impact on your sleep. Implementing these changes consistently is key for building sustainable, healthy sleep patterns. For someone experiencing early signs of insomnia, these are the fundamental and effective steps they can take to improve their sleep naturally.
That's very clear and practical steps. Thank you for detailing the principles of sleep hygiene and other lifestyle adjustments. Now, many people wonder about the role of diet and supplements. Are there specific foods or supplements that you would recommend for supporting sleep, or any to be cautious about?
Yes, diet and certain supplements are often discussed in the context of sleep. While they are not typically the primary solution for chronic insomnia, some can play a supportive role or help avoid disrupting sleep. Regarding foods, certain nutrients and compounds have been linked to sleep regulation. Foods containing tryptophan. This is an amino acid that the body converts into serotonin, which is then a precursor to melatonin. Foods rich in tryptophan include poultry, milk and dairy products, nuts, seeds, bananas, oats, and legumes. Consuming a small, balanced snack containing tryptophan and a carbohydrate a couple of hours before bed may theoretically help with sleep onset, though the effect is often modest. Avoid very large or heavy meals before sleep. Foods rich in magnesium. Magnesium is a mineral involved in numerous biochemical reactions, including those related to nerve function and relaxation. Some research suggests adequate magnesium intake is linked to better sleep quality. Good dietary sources include leafy green vegetables, spinach, kale, nuts and seeds, almonds, pumpkin seeds, whole grains, and legumes. Cherries, particularly tart cherries. Some studies suggest that tart cherries or tart cherry juice may help improve sleep, possibly due to their natural melatonin content and anti-inflammatory properties. Concerning beverages, traditional options include warm milk or certain herbal teas like chamomile, which are generally considered to have calming effects. Valerian root tea is another option often used for sleep, but it can have stronger effects and potential interactions, so it warrants caution. When we look at supplements, it's important to approach them with careful consideration and professional guidance. Melatonin supplements. Melatonin is a hormone that signals darkness and helps regulate the sleep-wake cycle. Supplementation can be helpful for some individuals, particularly older adults whose natural melatonin production may be lower, or for issues like delayed sleep phase. However, dosage is important. Often a low dose, e.g. 0.5 milligrams to 1 milligram, taken about 1 to 2 hours before the desired bedtime, is sufficient. Higher doses are not necessarily more effective and can lead to daytime grogginess. It is crucial to discuss melatonin use with your doctor to determine if it is appropriate for your specific situation, considering timing and potential interactions. Magnesium supplements. If a magnesium deficiency is confirmed through testing, supplementation may help improve sleep. However, Simply taking magnesium without a diagnosed deficiency may not resolve insomnia. Valerian root supplements. As with the tea, these supplements are used for their potential sedative effects. Due to potential interactions and variability in effectiveness, they should be used cautiously and ideally discussed with a healthcare provider. It is essential to understand that supplements are not intended as a long-term solution for chronic insomnia. They can be supportive tools in some cases, but they do not address the underlying behavioral, psychological, or medical causes of persistent sleep problems. Lifestyle changes and behavioral therapies are generally more effective and sustainable for chronic insomnia. Always consult your doctor before starting any new supplement, especially if you have existing health conditions or are taking other medications, as interactions can occur. Regarding foods to be cautious about, as mentioned, avoid heavy or rich meals close to bedtime. Also, be mindful of hidden sources of caffeine and avoid excessive alcohol intake in the evening.
Wow, thanks for the advice, doctor. Now, Dr. Hayes, if someone has implemented sleep hygiene and made lifestyle changes, but is still significantly struggling with insomnia that affects their daily life, what is the next step? When should they seek professional medical help? And what are the potential treatment options available beyond lifestyle adjustments?
This is a crucial point. If insomnia persists despite consistent efforts with sleep hygiene and lifestyle changes, it is definitely time to seek professional medical evaluation. Do not feel discouraged or that you have failed. Chronic insomnia is often complex and may have underlying causes that require medical diagnosis and intervention. Your doctor will conduct a thorough assessment to understand the nature and potential causes of your insomnia. This evaluation may include taking a detailed medical history. Many medical conditions, such as heart disease, lung problems, chronic pain conditions, thyroid disorders, neurological issues, and even acid reflux, can disrupt sleep. Reviewing all medications. Numerous prescription drugs, over-the-counter medications, and even supplements can interfere with sleep patterns. Your doctor will assess your current medications and may suggest adjustments to timing, dosage, or alternatives if a medication is suspected to be contributing to insomnia. This is a very common factor in older adults. Discussing your sleep patterns and habits. Providing a detailed account of your sleep schedule, habits, and difficulties is very helpful. Your doctor may ask you to keep a sleep diary for 1 or 2 weeks to track your sleep and wake times, nighttime awakenings, naps, and any factors that might be affecting your sleep. Evaluating for other sleep disorders. Conditions like sleep apnea, brief pauses in breathing during sleep, or restless leg syndrome, an irresistible urge to move the legs, often accompanied by uncomfortable sensations, are common in older adults and can cause insomnia. If suspected, your doctor may recommend a sleep study, polysomnography, to diagnose these conditions. Once underlying medical conditions or medication side effects are addressed, specific treatment for chronic insomnia are considered. The gold standard non-pharmacological treatment for chronic insomnia is cognitive behavioral therapy for insomnia, or CBTI. This is a highly effective, evidence-based therapy that addresses the thoughts and behaviors that contribute to difficulty sleeping. It is typically delivered over several sessions by a trained therapist and provides long-lasting results. CBTI techniques include cognitive restructuring, identifying and challenging unhelpful beliefs and worries about sleep. Stimulus control, reassociating the bedroom with sleep by limiting time spent in bed while awake. Sleep restriction, temporarily limiting time in bed to increase sleep drive, followed by gradual increases. This is done under professional guidance. Sleep hygiene education, reinforcing and tailoring good sleep habits. Relaxation techniques, teaching methods to reduce arousal before bedtime. CBTI is recommended as the first-line treatment for chronic insomnia in adults, including older adults, because it addresses the root causes and provides sustainable improvements without the risks associated with long-term medication use. Regarding prescription sleep medications, they may be considered in certain circumstances, but often with caution and typically for short durations in older adults. This is due to potential risks such as increased risk of falls. Next day, cognitive impairment, potential for dependence, and interactions with other medications. Your doctor will carefully assess if medication is appropriate, discuss the risks and benefits, and prescribe the lowest effective dose for the shortest necessary period. Medications are rarely the sole or long-term solution for chronic insomnia. Other management strategies might involve coordinating care to optimize treatment for coexisting medical conditions that are disrupting sleep. The key message is that persistent insomnia is a medical condition that warrants professional evaluation. Effective treatments are available, and for many, non-drug therapies like CBTI offer the best long-term solution. Do not feel helpless. Seek assistance to find the approach that works best for you.
Thank you, Dr. Hayes, for outlining those steps and highlighting CBTI as such a valuable non-drug approach. It's reassuring to know there are structured and effective therapies available. As we conclude our conversation, Dr. Hayes, for our listeners who may be feeling overwhelmed or discouraged by their sleep challenges, what final piece of advice or encouragement would you like to offer?
My final message is one of encouragement and empowerment. Chronic insomnia is a common and challenging issue in older adults, but it is important to remember that it is often treatable. You do not have to resign yourself to ongoing sleepless nights. Begin by carefully reviewing your sleep habits and implementing the principles of good sleep hygiene consistently. Be patient with the process. Establishing healthier sleep patterns takes time and perseverance. If you continue to struggle, please do not hesitate to seek help from your doctor. Openly discussing your sleep difficulties is the first step towards finding effective solutions. Prioritizing your sleep is a fundamental component of prioritizing your overall health, safety, and well-being as you age. Taking active steps to address insomnia is an investment that can significantly improve how you feel, your cognitive function, and your ability to remain active and engaged in life. Better sleep is an achievable goal for most individuals with the right approach and support.
Better sleep is an achievable goal. That is a positive and motivating message, Dr. Hayes. Thank you so much for sharing your expertise and providing such clear, practical, and hopeful guidance today.
It was my pleasure, Emily. I hope this discussion provides valuable information and encourages listeners to seek the help they need for more restful sleep.
And thank you, our valued listeners, for tuning in to The Vital Years. We hope this episode has increased your understanding of insomnia in older adults and inspired you to take proactive steps towards improving your sleep. Remember, investing in your sleep is investing in your vital years. Join us next time for more insights on healthy aging.